Welcome to BioIT World's Trends from the Trenches podcast, your insider's look at the science, technology, and executive trends driving the life sciences. I'm Allison Proffitt, editor of BioIT World. This episode is hosted by Stan Gloss, founder of BioTeam, a life sciences IT consulting company at the intersection of science, data, and technology. Joining Stan today is Rémy Evard, Chief Digital Officer and Head of Technology at Memorial Sloan Kettering. Together, they delve into the impact of cloud technology, the rapid development of AI, and the challenges of maintaining healthcare quality during a time of declining resources. Let's listen in.
Well, good afternoon, Rémy. Boy, I'm so glad to finally get you on my podcast. We've known each other now for almost 20 years.
Yep.
It's been a long time. I first met you when you were at Novartis, I believe.
I think that's right.
Many years ago.
Right.
So
Ages.
yeah, so I'd like to explore the new work that you're doing at Memorial Sloan Kettering, but for everybody's benefit, maybe you can kind of help for the few people in this industry that don't know who you are. Maybe you can kind of share a little bit about your background and your current position.
Absolutely, Stan. So great to be here. Thanks for twisting my arm a bunch to get, this is delightful. Context is sort of relevant to your community, my community. The background I've got that has me now at Memorial Sloan Kettering is actually started in the 90s. Crazily enough, I was at RD National Laboratory doing high performance computing. And, I thought I left that, but that still remains incredibly relevant to me and to your community here and to all of us.
Mm-hmm.
But back then I was helping build computers for, the fastest open science, the non-warfare related science and computing that we could do. And that led to almost everything else that followed. So I was there for 10 years doing big science, big computing. I left there and went to Novartis, which is where I met you. At Novartis, I was the Chief Information Officer for research for about 12 years, the research division of Novartis called NIBR. And for a little while in there, I was also the CIO simultaneously for the development organization. So in that, I learned a little bit about, clinical trials and so on, but it was largely on the science side of Novartis. Left there somewhere around 2018, spent 3 years in the biotech space, launching biotechs, working for Flagship. That was an amazing change because I got to bring in what I learned about drug discovery and development and so on into the really small organizations, like starting with one person in biotech, and learn where IT, data, and so on, how that started at the beginning and how that grows with the company. And look, honestly, my goal in that place in building those companies, as I said to people, is to try to avoid all the disasters I had been dealing with in Novartis for the last 12 years in the data and technology spaces. Like, can you get it right from the beginning and just hold it all the way through? And that was an interesting puzzle. And after 3 years of Flagship and a pandemic and some shifts, I joined Memorial Sloan Kettering down in New York City, which is my first foray into healthcare. And the reason I did that is they had opened up a role for Chief Digital Officer, and talking about digital and data transformation, it was incredibly compelling. I wanted to shift to the impact of all the work that I'd been doing before around drugs and so on, work more closely with patients and really understand what it's like to be working for a hospital.
Mm-hmm. So I want to reflect back on the high performance computing side because you caught my attention, because we've been at this for an awful long time. And back when I first met you, it was convincing people that high performance computing is important for your science, and you can't do all your science on your notebook computer and Excel spreadsheets.
Mm-hmm.
And it's just funny how over time now high performance computing is actually, it's not even infrastructure. It's really an extension of the laboratory. Do you see, you see it that way?
I see a spectrum of that. There's places where absolutely it's built in and it's completely normalized. And there's still the collection of leaders, even in the science space, they're like, what is that again? And you're like, GPUs, let's just talk GPUs. You've heard, And so it's absolutely more normalized and more aware. I'm not sure we're any better at it in many institutions, by the way, than we were back then, to be honest. But yeah, it's absolutely more common.
Yeah, and certainly we'll probably get into the role that AI plays in now making, high performance computing the high performance computing that's driving AI behind it becomes, again, back center stage. So anyway, when I think about Memorial Sloan Kettering, I mean, I remember a couple conversations that we had, and one of the facts that just kind of blew my mind is it said, well, you do know that we do 5,000 clinical trials a year. And I was like, what? That's crazy number of trials. And so to think about all the when you talk about digital transformation, that's part of it. I mean, there's still the regular science that you're doing in addition to all of that. So that's a pretty tall order to try to sort out, isn't it?
We have an amazing clinical trial organization at MSK. And so it is a tall order, and they're all over it. And so in my role as Chief Digital Officer, I tend to think of them as yet another incredibly complicated client needing everything that my organization is providing.
Mm-hmm.
And so, yes, but also no. And when you're looking at it from outside, it looks kind of like a CRO embedded in a hospital, or it looks like the development organization if you're over in research and pharma. They're very deep into it, and it needs to be integrated into the hospital practices, and the data needs to flow in appropriate ways. But it is yet another complicated, deeply expertise-oriented function inside of MSK.
Right. And the other part of this is that you still have a research organization that's doing active fundamental research, right? That supports this too. So it's not just
go back and explain MSK a tiny bit.
Okay.
And here's the amusing and or frustrating thing for me, having joined this hospital, knowing nothing about how hospitals work, is I still know almost nothing about how hospitals work after 3 years, because MSK is this odd, unique beast. I can't really generalize what I'm learning. So let me explain that. It's an
please.
It's got. I've sitting in the CDO role, I largely think about MSK as having three major components. Call them three major business divisions, if you will, like if you were inside of pharma. One is the hospital proper, and it's not a normal hospital, and the clinical trials group is inside of the hospital. So that's the patient-facing part of MSK, and it's by far the bulk. It's like 80% of MSK down, and it's all New York City based in the region and out in New Jersey. The second part is the basic science organization, and that's partly in an institute called the Sloan Kettering Institute, and also partly permeates the hospital because we have physicians who are researchers. So when you come in and you're looking for the scientists and the people who are doing research, you start in one part of the organization and you realize it's all over the place. And working with that community that way is actually quite difficult. It doesn't line up with the normal enterprise view. And then the third vertical is just the business, the administration side, where you have HR and facilities and finance and all. And that feels completely corporate, like that mapped completely over from my Novartis world, almost exactly the same kind of dynamics, except that the people in that space are largely experts in running hospitals. And so you have all three of those dynamics in completely different kinds of cultures together making MSK. And then you have the fact that MSK only does cancer. So MSK doesn't have an emergency room. It has an urgent care department that looks a lot like an emergency room. But if you've broken your arm, you can't go to MSK and get help. You have to go across the street to one of the competing and friendly neighborhood hospitals that's on the other side of York Avenue. Right. So it's only cancer. And that means that people who are coming to MSK have been diagnosed somewhere else with cancer and sent to MSK for the treatment of that. So it is not. That's why I'm saying I don't actually know how normal hospitals work, because I know how an academic medical cancer only hospital works. And it's crazy data intensive and crazy digital intensive. But I have no idea if this generalizes.
So what does the chief digital officer do in the environment that you just described?
So they created this role about 5 years ago. So before I joined, like I said, I've been there almost 3. And the concept in this was to unify the various separate IT, informatics, data related organizations, part of them anyway, into one central IT plus organization to provide common services and common digital strategy across all of MSK. Put that under a chief digital officer, renamed things various ways, focus on digital as opposed to sort of CIO level kinds of things. But the concept is to get real value out of that, either independent of other things going on, like having its own potential P&L around products and services and so on, but largely to enable a broader digital strategy across all of MSK. So I'm responsible for the central organization that does all of that, supporting all of MSK.
Well, given the complexity of your organization, what do you think the biggest challenges that you face on a fairly regular basis? I mean, you just described this three-legged organization and area, each one having unique and very important needs that have to be cared for using your digital strategy. So, what challenges are you facing in that environment?
Name a challenge, and we're probably facing it right now. It's a little bit that doesn't help you with it, but it's somewhat ridiculous. It's the normal collection of IT challenges that you have in an enterprise, plus very specific ones in the hospital and very completely different ones in the research organization. Some of those overlap. The commonality is underlying infrastructure and data and security. But walking across those components of MSK, I would say, look, the biggest, broadest challenge that MSK is facing, and I think almost all hospitals are facing, is the ongoing crunch of finances and resources available to clinical care across the United States. And speaking as a patient, getting an inside view into how this works, I'm actually quite alarmed because you look at the decreasing revenue and the increasing cost, and it's a really tough spot for the vast majority of hospitals that are in that. And MSK is in that space better than many, but still struggling with those same dynamics. So at the highest level, I'm being asked to provide absolutely top tier digital services across all of MSK in an increasingly tight resource world, which everybody faces. But that's new to MSK in the last several years. And it's actually very difficult to figure out how to navigate that while keeping things running smoothly, moving forward, major number of projects secure, all the rest of it. That's the broad, typical, boring challenge. But when I look at it, it doesn't look solvable in all possible ways. Things are going to go, some places we're going to be degrading quality in order to keep up in other places.
Well, I mean, it's interesting because, we just heard the announcement from Walgreens saying that they're going to be closing some of their because of a declining reimbursement structure.
Exactly that.
And we're also getting very much challenged in our rural healthcare delivery system for the same reason. So it is an endemic problem in the industry, trying to figure out how do we maintain quality at the time of declining resources. And that's a challenging thing for a large organization.
I recently got a hold of a graph looking at the quality of IT delivery across hospitals. And this doesn't it doesn't differentiate academic hospitals from others, but it's the broad collection of hospitals. And it was a really simple 2x2. And on the left-hand side were IT organizations that are in trouble. And on the right-hand side are IT organizations that are doing well. And there were various strategies for lines and so on. But the key point on that, 70% of hospital IT organizations are at just keeping the lights on. And again, as a patient, I kind of don't want that. I'd like their data to be good and consistent, for example.
Right. And that's funny because I would have thought one of your biggest challenges, because I've done so many interviews across the academic, commercial, and this is really one of my first nonprofit type interviews, was everybody's screaming and yelling about the data.
On the hospital side, we're trying to modernize the collection of clinical applications, and we're deploying Epic. We're late to the game in deploying Epic. We're one of the last cancer centers, one of the last New York hospitals to do that, but that's a massive change. And that's a cultural change. And from a technology standpoint, there's a whole interesting puzzle around, do you want to move to this massive platform that drives everything that you basically kind of have no choice? You need to go to something that runs the hospital. There's a whole conversation there we can go into. The project's underway. We're going live in February. That's the single biggest deal going on in technology and actually organization-wise in the hospital right now. And that I launched about 5 weeks after joining because it was obvious. That's one challenge. Off on the research side, completely different kind of conversation. Their biggest challenge is exactly what you're talking about. They need more computing, they need more GPUs, they need more storage space, and the costs for that are going up exponentially because of the amount that they need. Like, science is data-driven and digitally enabled these days, even more so. If we deployed the amount of storage that we need next year to keep up with the requests for storage, assuming they're all legitimate requests, and most of them are going to be close, we would literally double the number of disks, the amount of storage we have in our data centers and the amount of storage we have in the cloud. Double in 1 year.
Wow. That's
Like,
amazing.
sustainable. When you look at that, I'm kind of like, what is going on with this? And how do you keep up with that? And then having the expertise to organize that, manage it, compute on it, keep up with it. That's necessary because all of our research programs are going that direction. All of them are using AI in one way or another because it relates, it's enabled various things. It lines up with what you want to see in the journals and so on. So that's exploding in two different directions. And behind the scenes in the business part, that third vertical, we're just trying to run the place.
Are you enjoying the conversation? We'd love to hear from you. Please subscribe to the podcast and give us a rating. It helps other people find and join the conversation. If you've got speaker or topic ideas, we'd love to hear those too. You can send them in a podcast review.
So when you start to look at those costs and do you have to take a look at, are you using cloud computing?
Yep.
Because that for a long time was the favorite buzzword that was mentioned in every corporate boardroom. Let's go to the cloud.
That'll solve everything.
And it was, so has there been as what Chris Dagg calls a little bit of cloud sobriety going on, and people
I was actually wondering about Chris's numbers the other day because I'm hearing data center popularity is going up, and when you look at your cloud costs and the degree of lock-in, why, if that's true.
Mm-hmm. Yeah, I mean it's a lot of things that they thought were going to be less expensive in the cloud. It is certainly convenient, and the cloud really saved a lot of research during COVID and the migration, the ability to get at cloud resources when we had problems with supply chains and getting CPUs. That was a godsend.
The cloud turned around biotech, in my view, when all those startups that I was launching in Flagship, they were exclusively on the cloud, and they couldn't have been moving and enabled as fast as they were without all the cloud, whether it's cloud computing or SaaS and so on. I mean, our rule there was you're not allowed to have a piece of hardware unless it's like laptop at video conference, except for your small little cluster in the closet that's running 24/7. Right. Mm-hmm. But in the enterprise, that's almost completely different. It's more or less you continually are evaluating, should I be renting this because I want to move on, or should I buy it because I'm going to own it for a long time?
Well, right. And, when I was working with you with those startups, startup people have to think about how fast they want to burn through their startup money and whether or not going out and investing in actual physical hardware makes sense. And I still have not seen
you have to live long enough for it to depreciate.
Exactly. And you don't know whether you hope that the equipment would last longer than the company that you're trying to launch, but not all ventures really make it to commercial reality.
The cloud doesn't help us with the cost management. It helps us with flexibility and responding to demand, which is what the cloud was around before. We don't know how we're going to survive next year's data explosion, but it comes down to practices you guys have been preaching for decades, which is rational data management, prioritization, governance around what you're actually computing on, having the ability to do tiered management of all of these things, and knowing where your costs are going.
Exactly.
It's really boring. We need to get that in place, though, right? That's
and especially in an environment where you're going to be resource constrained. It's no different than managing your house
everywhere.
It's everywhere in everybody's household budget too. The increased costs of everything are going to force you to make some hard decisions.
Yeah.
And the question is, are you making those hard decisions emotionally, or are you making them rationally based on legitimate data? Are you because some of the activity I saw around the cloud absolutely was emotional.
Well, AI.
And yeah, AI is the next buzzword that everybody's believing. There is some really good activity going on around the use of AI and good applications, but still, everybody wants to do it. My challenge when I look at organizations is that they want to do AI, but they really haven't gotten their data house in order yet.
Yep, 100%.
And without good training data, AI is only as good as the training set that you have built for it, because it needs good data to make good decisions and good results. So this kind of idea of having your data AI ready, I think more organizations are still doing it. I think it's a good idea, though, that in small use cases where people have really good data sets to actually run and get experience with AI, I think that's a good idea. But, broadly doing it, I'm not sure a broad approach at this stage of where everybody's at is even feasible. But it's one of those things, everybody wants it.
Yeah, I still think we're at the stage of let's calm down the irrational exuberance and do pilots, learn, let the technologies mature. They're changing rapidly. Don't get overexcited. Figure out what you can do with what you've got and sort of minimize the degree to which you're investing and gambling, at least for businesses and enterprises as opposed to investors.
Yeah, that's a good piece. I think that's a rational piece of advice on thinking about AI. Any other interesting parts of your world that we would love to hear about in terms of those kinds of things?
I think if you step back and you look at what we have and ask the question around potential, I think like all of the research projects are amazing in and of themselves, and we have any number of papers and so on that are key and have changed things. But I think as a cancer center, the real crown jewel that we have of potential is the longitudinal patient data of what the treatment plan has been and what the results are and how those relate and what you can learn from them. And we've been doing a ton of work in collecting that and adding as much information as we can get, genotypic information, phenotypic information, to enrich that. And I think all of the cancer centers and most of the hospitals are doing that kind of thing to a various degree. The interesting question is unifying those and making those computable across the hospital so that you get the much broader data set, and doing that in a way that that protects IP, protects data, protects patient privacy, but also doing it in a way that we can move the fight against cancer forward that much faster. So there's conversations between the hospitals about how to do that. I think there are various approaches you can take with AI and some of the computing approaches that may help with that. That's what I'm going to be interested in the coming years on this.
And I'm glad, because as a person whose father passed away from pancreatic cancer, the year that I founded BioTeam, I want to hear organizations like yours talking about telling me longitudinal information so that I can make a wise decision on which cancer therapies, protocols, organizations that give me the highest chance to get diagnosed and treated as quickly as possible.
Yeah, that's right. I completely agree. My father also died of cancer. And I would say, one of the things that I think has really been a bright spot for me in joining MSK, and there have been a lot, but it's getting to know the leadership, the clinical leadership, the scientific leadership of MSK, and understanding that they're there to do what we're talking about right now, which is to get those breakthroughs that matter and get them into patients and to tackle this disease even further, as opposed to being there for, being at some amazing organization or the compensation, like that's all in there. But this driving mission to make a difference is actually there. It's not just hype. And that's the part that makes me feel good about this pretty much every day.
So we're getting close to wrapping up here. I want to ask you one final question. If you would take what you know now and go back 10, 15 years, and what advice would you have given yourself now based on what you've known now? So if you go back to yourself 15 years ago, what would you be telling yourself now based on what you know now?
I would be telling myself to work less.
Okay.
Look, life is bigger than work. And there's an awful lot of stuff that I put an enormous amount of energy into that didn't matter a lot. It's the relationships with the people that you're working with and the things that you accomplish together that you look back on and go, yeah, that part mattered. Infinite number of budget meetings, who cares, right? Mm-hmm. Presentation for the board, the vast majority of them, who cares? But why are you there? Who are you working with? Why is it important to you personally? How does it fit into your bigger life, broader than work? What's the right balance? That's what I would tell myself 15 years ago.
Perfect. Rémy, thank you so much. I've really enjoyed this conversation, and I thank you.
A lot of fun, Stan. Anytime.
Thank you for listening to BioIT World's Trends from the Trenches podcast.